Circuit breaker will lift in a few days' time from 2nd of June. In the past week, the number of COVID-19 cases in the community has remained low. A number of cases were picked up more as a result of proactive screening and testing of nursing homes as well as the preschool sector. I will ask DMS Professor Kenneth Mak to elaborate later on the cases that we have discovered among the preschool teachers. As we know more about COVID-19 as a result of both global research as well as research done locally, we will adjust our medical plan for COVID-19 patients. This would ensure optimal care for our patients as well as deployment of medical resources. NCID and the chapter of infectious disease physicians issued a position paper recently which showed that the COVID-19 patients are no longer infectious by day 21, despite being tested positive for COVID-19. Professor Liu Yixin, Executive Director of the National Center for Infectious Diseases, will explain further later. In fact, the World Health Organization has also published on 27th of May its recommendation to shift from transmission-based to a time-based discharge, and patients who are clinically well can now be discharged from after 10 days from the onset of illness, plus at least 3 days without respiratory symptoms or fever. The task force will therefore revise the discharge criteria for COVID-19 patients in Singapore. With immediate effect, all COVID-19 patients who are assessed to be clinically well by day 21 of onset of illness can be discharged without the need for further PCR tests. As an added precaution, they will be required to remain at home or dormitories for a further 7 days to rest and recover. After day 28, these recovered individuals can return to work. This revised approach will allow recovered patients who are well and no longer infectious to return to the community in a timely manner. Even as we prepare to gradually reopen in Phase 1, we will share the roadmap of our Phase 2 so that we know what will lie ahead of us. Minister Lawrence Wong will elaborate on this roadmap later. As there will be fewer restrictions in Phase 2, individuals and businesses will play an even more critical role. Every one of us needs to exercise greater social responsibility, remain vigilant, and adhere strictly to safe management measures. If we all play our part, we'll be able to arrive at Phase 3 safely. Now I would like to invite Professor Mak, DMS, to give an update on the medical cases, as well as give some details on the screening tests among our preschool teachers.
Thank you very much, Minister. We've announced earlier this afternoon that we had 373 new cases confirmed with having COVID-19 infection in Singapore. The vast majority of them remain work permit holders residing in foreign worker dormitories. Today, there are no Singaporeans or permanent resident cases. We will work through the rest of the details and provide further updates this evening. As Minister has said, we have been performing swab screening tests in the preschool setting, and as of the 26th of May, we had performed a total of more than 33,100 tests for staff that work in the preschool setting, of which we had 12 positive tests as of the 26th of May, and this comes to a percentage of positive cases in the order of 0.036%. We went ahead and looked very closely at each of these test results and also performed serology tests for all 12 of these staff members. The serology test for 11 of these staff members has come out, and all of them had a positive serology test. The remaining staff member has his test pending. The results of the serology test together with the PCR test that we performed, were then critically evaluated, and the evidence suggests that these are not active fresh infections, but in fact these are old infections, and the test results in fact suggest that these staff members have all recovered from their infection. As a result, it is our evaluation and our assessment that none of these staff members currently are a risk to either other colleagues within the preschool setting or to the children that are supported and cared for by the preschool staff. And this, of course, means that they are not infectious and there's less of a concern. It also, therefore, implies that somewhere earlier, we are unable to say for sure exactly when that would be, these staff members would have been exposed to COVID-19 infection and therefore got infected themselves. The majority of these staff members are asymptomatic. They are all well, and we believe that they've, in fact, made a full recovery without any other sequelae. It reaffirms in our assessment that previously, prior to the circuit breaker being imposed, there was some level of community spread, but with the circuit breaker in place, we have seen the number of community active cases coming down very significantly, which is consistent with our assessment that the circuit breaker measures have been effective. Thank you.
Thank you. Now I'd like to invite Professor Liu Yuxin to share with us her professional perspective of the COVID-19.
I will present to you the local findings, the 3 local studies, to add to the bodies of evidence of science for COVID-19. So first, I would like to introduce to you the very first study that we have done in NCID on the first 18 cases. These 18 cases shows clearly that the virus shedding or the quantity of virus that we can quantitate, in fact, is the highest during the early onset of clinical illness. And with time, the level of this viral quantity declines. And the second study I would like to present to you is the actual real patient data that we have taken from our patients in the ward. And altogether, we have 766 cases that we analyzed. And we found that about 30% of them can clear the PCR tests by the time they reach 15th day of their clinical illness. And by 21st day of clinical illness, about 68% of them can clear the PCR. And by about day 33, that is more than 1 month, we have 95% of our patients able to clear the PCR test. So in other words, we still have a small number of cases continue to be tested PCR positive for a very prolonged period of time. Then we went on to do a third local study, and what we did was to follow 73 individuals on the regular basis. We test their PCR and we send the respiratory sample for culture. And we found that when the viral quantity reduced to a certain level, we use cycle thresher as one of the measurements. Once it is more than 30 and above, we can no longer culture the virus from the respiratory sample. And by such time, most of the patients would reach beyond day 10, day 11 of clinical illness. So if we were to take all these scientific informations together, we are confident to say that by the time they reach day 11, and by the time they reach 2 weeks of their clinical illness, we can no longer have any viable virus that we can culture from the respiratory sample. And I hope that these local studies will continue to add to the scientific evidence and be able to support patient movement, patient management forward. Thank you.
Thank you. I'll now ask Minister Lawrence Wong to talk about our roadmap to phase 2.
Good evening. The Multi-Ministry Task Force has announced and explained the framework for the reopening of our economy and society over 3 phases. So let me now briefly sketch out what all of us can expect in the coming weeks. The circuit breaker will end on the 1st of June, and thereafter we embark on Phase 1, which we have already announced and explained. Phase 1 alone will see about 75% of the economy resuming operations. Thereafter, we will continue to monitor the situation, particularly over the first 2 weeks of June. If the community transmission, if infection rates over these 2 weeks remain low and stable, then we will decide by the middle of June on whether we want to take the next step to move to Phase 2. And that means that Phase 2 could happen before the end of June. Broadly speaking, Phase 2 will entail the resumption of a wider range of activities, and we expect almost the entire economy to reopen by the start of Phase 2. And the broad items that we are looking at for resumption of activities in Phase 2 would include, for example, retail shops and consumer services. It would include dining in at F&B outlets, but subject to a cap of up to 5 people. It would include the opening of sports facilities and more public venues, including stadiums and swimming pools. It would include allowing social interactions and family visits, again subject to this group size capped at 5 people. There will be activities in higher risk settings which we will have to look at more carefully. These are typically activities or venues with large gatherings of people or close contacts of people in enclosed spaces. They would include places like museums, libraries, cinemas and theaters, religious functions. They would also include venues like bars, pubs, clubs and discos. All of these venues and settings, based on our experience and overseas experience, have been instances where there have been cases of transmission in such settings. And so we want to take a more cautious approach for activities in these areas to resume. So what we will do is we will begin conversations and discussions with businesses and organizations across these different settings on the safeguards and safe management measures that will be needed. And subject to these measures being in place, we will then discuss with the entities on the precise timing of when they can resume activities within Phase 2. So they may not all resume at the start of Phase 2, but if they have the safeguards and precautions in place, they could resume later, but still within Phase 2. In parallel, while we talk about reopening of these activities in our community, in parallel, we are also continuing with conversations and work on reopening our borders, establishing travel bubbles with countries where the virus situation is under control, and having safe green lane travel arrangements with specific countries. And the idea is to have clear protocols in place that would include testing of travelers from one country to Singapore and vice versa. And with these testing protocols in place, we can have assurance that the traveler is free from infection, and then essential travel can then resume step by step, right, depending on the countries that we have established these green lanes or travel bubbles with. So that's work in progress. The conversations and the discussions we are having with countries vary, some at more advanced stages, some we are just starting. And as and when we are ready, we will announce more details on any particular country for which we have reached agreement. This will allow essential travel to resume. and particularly for businesses that are based here in Singapore, where their staff and employees need to have some travel around the region. I think this is going to be an important measure that will allow not only business to resume, but jobs to continue. And we can then ensure that Singaporeans can continue to work, not just in Singapore, but in places where they need to travel for work. Having these arrangements does not mean that we will allow mass market travel. That will take a bit longer. So the arrangements I've just described refers to essential travel, subject to all the arrangements and safeguards as I've just described, and the travel bubble that we would work out with respective countries. It's not for mass market travel, which I think would take a lot longer to resume, not just in Singapore, but also internationally. So those are the things that we are working on now, and we thought it would be useful to share with Singaporeans to give everyone a clearer sense of what to expect over the coming weeks, both in terms of the reopening, phase 1, and then subsequently to phase 2 before the end of June, possibly, as I said, depending on the situation and the assessment of our community transmission in the first 2 weeks of June. And also, we are working on easing of travel restrictions and resuming of travel with specific countries. As we do all of these things, we can expect activity level to rise, and therefore, I want to reiterate what Minister Gan said just now. It is even more important for everyone to take responsibility of their actions. Because with more activities, the likelihood of transmission rises, and we have to be prepared that there will be more cases. So it's all the more important for us to stay vigilant, to be socially responsible, and to do all the necessary things that each individual has to do. Do not just rely on government measures or government rules. All of us have to do our part as individuals, uphold high standards of personal hygiene, wear a mask when we are out, and see a doctor if we are ill, all these basic precautions that we have been talking about since the start of the outbreak. For businesses too, they have to take responsibility, put in place safe management practices in their workplaces, ensure that their work settings are safe, not only for their employees, but also for their customers. And we certainly hope that businesses will step up. For those that are unable to resume operations immediately after the circuit breaker, use this period, use the next few weeks to put in place all the necessary precautions and measures that you can in your work premise and make it safe for your employees as well as your customers. This is absolutely critical in order for us to be able to resume safely. And as we prepare ahead for phase 1 and later phase 2, we will continue, of course, to be vigilant and take prompt enforcement action. Businesses must be aware that if a case were to emerge in their workplace setting, if clusters were to emerge later, they run the risk of having their entire outlet, their entire business or shop closed for quite a while. So I think this should give every incentive for businesses to take responsibility and to do their part to put in place all the necessary precautions and safeguards so that they can resume and reopen safely. So I hope this provides a better sense of what everyone can expect in the coming weeks. The situation is uncertain, it is fluid, many things can change, but we've put out as much as we can the information or the things that Singaporeans can expect in the coming weeks ahead so that everyone has a clearer picture of what we will be embarking towards, starting with phase 1 and then moving on to phase 2 later on. Thank you.
Questions from the floor?
Thank you, panelists. We will now begin with the Q&A segment. Members of the media, please Please remember to use the raise hand button if you would like to ask a question. Please only ask one question to allow more to participate in the Q&A. May we now have the first question from Timothy from Straits Times, please.
Thank you, Ministers, DMS, Professor. Now, given that MOH had previously said it was conducting the double negative test just to be extra safe, does it have a plan to allay fears of community spread just in case NCID's position paper was wrong? And what does this new discharge criteria mean for the community isolation facilities and the hospitals? Thank you.
Thank you. I'll ask DMS to elaborate, but in a nutshell, I think we have studied the NCID's research, as well as studied the research and evidence from international studies, as well as take into account a recommendation from the World Health Organization. I think we are, in fact, extra safe. World Health Organization's recommendation is 10 days from the onset of illness, plus 3 days of asymptomatic, free of symptoms, which is probably about 2 weeks or so. We are saying that 21 days, then we will then discharge them back to home, continue to take precautions and stay home to recover and rest, and they are only allowed to go back to work or to the broader community after 28 days. So that already is an extra additional precaution. So I'll ask DMS to elaborate further.
Thank you very much, Minister. Just to clarify, WHO's recommendation that came out yesterday was that for symptomatic patients with COVID-19 infection, they should stay isolated for a minimum of 10 days, of which 3 of the days should be symptom-free before these patients can be safely discharged without the need for any further testing. In asymptomatic patients, they would just recommend 10 days straight off, simply because these patients do not have any symptoms at all. So WHO's recommendation, in fact, is for 10 days. Based on the evidence that has been presented to us, both from NCID together with the chapter of Infectious Disease Physicians Academy of Medicine Singapore, and the international evidence coming out from countries like Germany, Korea, and other countries as well, we are confident that the data is showing consistently that patients with COVID-19 infection will pass a certain time point where they will not be infectious anymore, and that time point is probably somewhere in the 10-day, 11-day mark. However, we have an abundance of caution that we have exercised, and this is because of our commitment to the community to make sure that as we return COVID-19 infected patients back into the community, we want it to be a safe process such that there should not be any concern for further spread of infection from these individuals to other members in the community. This was the same approach we had, the same principle that we had followed when we previously had advocated the protocol involving 2 consecutive negative swab tests before we discharge patients. So while the evidence and the recommendations are to isolate patients for at least 10 days, we have taken the precaution of, in fact, continue to keep them through to 21 days before we isolate them, and then subsequently let them either return to home or return to where the original place of residence was. Even then, we would recommend a further leave of absence for these individuals for another 7 days before they actually return back to work, to ensure that they fully recover and they're ready, therefore, for returning back to work without any problems at all. So it's already with an abundance of caution that we have put together a protocol that allows us now to safely move away from needing to test every individual before we discharge them. And the duration that we continue to keep them isolated is, in fact, much longer than even what the WHO recommends. And this is so as to assure ourselves that when these individuals return to the community, they are well. As part of our protocol, we also want to take the precaution that for those who are having conditions that suppress their immune system, we would still, at this point in time, use the current protocol we have, which is still to test them to make sure that they have negative results before we let them go home. And this is simply because these individuals, being immunosuppressed, may not behave in the same way as others when it comes to dealing with an infection and recovering. But by and large, for the majority of people who are infected with COVID-19 infection, we are now confident that we can use a time-based protocol and let them be discharged after that 21 days without needing further testing.
Prof. Liu, you want to add something?
DMS has given a very clear outline of the approach that is evidence-based. And I would just say that while we borrow the evidence from the overseas international study, we do have evidence generated locally as well. So we are comfortable to look at what we have and the evidence that we can provide to support policies.
Thank you.
Thank you, panelists. Can we have the next question from Soon Kit from Zhao Bao?
Hi, good evening, Ministers. Just wondering, Minister Lawrence Wong talked about how the government has tried to put out as much as possible with regard to the plans. But I'm wondering if, was that, you mentioned about how the phase 2 could be brought forward to the middle of June. Is that due to the calls from
Sorry, Soon
businesses
Kit,
and shops?
we can't really hear you. Could you repeat your question, please?
Can you hear me now?
Yes, much better.
Good. Good evening, Minister Soon Kit from Zhao Bao. Minister Wong talked about how the government has tried to put out as much as possible, giving Singaporeans a roadmap ahead. Is this phase 2, the possibility of bringing it to the middle of June, a response to the calls from businesses who want to open their shops early? And while you've laid out the roadmap, you've given little information as opposed to what you've told us in the last week. So I'm wondering if how should Singaporeans actually anticipate what lies ahead?
First of all, just a point of clarification, we are not talking about moving to phase 2 by the middle of June. I said we will decide by the middle of June after looking at the data for the first 2 weeks of June. Then when we decide in the middle of June if we are able to proceed, then phase 2 can start, but it will not start immediately in the middle of June. We may have to give some time. So I said that then phase 2, if all goes well, phase 2 can indeed proceed before the end of June. So that has been consistent with what we have said before, that we talk about having phase 2 potentially around 4 weeks, maybe earlier. So that's still within the time frame that we have been talking about. It's just a little bit more clarity now on what people can expect in terms of the coming weeks. Middle of June, the task force will make a decision on the basis of the data that we observe in the first 2 weeks. And if indeed we are proceeding, phase 2 can happen before the middle of June. We are now also fleshing out in greater detail, right, what people can expect in the first phase of in the start of phase 2. Right? Earlier, we gave a very broad outline when we talk about the 3-phase opening, focusing more on phase 1 at that time, understandably, because that was the first phase. But now, as we are getting ready for phase 1 will, I think everyone knows what phase 1 is about. We are now giving a greater resolution to what phase 2 will entail, so that again, we want to give as much information as possible so that Singaporeans, people understand what can be expected in the coming weeks. And so this is, we hope, helpful for businesses, for families, for individuals as they look ahead to the coming weeks, wanting to, thinking about what they can expect, when they can meet one another, when businesses can reopen. We hope that such a roadmap will provide better clarity for people to just plan ahead. The caveat I should add is all of this is contingent on, as I said, us looking at the data, looking at actual experience, and looking at our infection numbers remaining low and stable, and then we can proceed on this plan. For now, I think based on what we have seen so far in the last few days, today, things look positive. And so if this trend continues and the conditions remain favorable, then we should be on track to make the decision according to the timeline which I've just described. But anything can happen. You know how the virus is, you know how the situation is. After this past 4 months, I think all of us are fully aware that things can be fluid and completely unpredictable. So I think we just have to have a word of caution. You know, things can change, but we are trying to provide the information based on what we are seeing, based on the current trends, so that people will have some sense of what to expect in the coming weeks.
Thank you, Minister. Can we have the next question from Si Hui from CNA?
Hi, with the immediate effect with the new discharge plan, how many patients will be discharged based on this new criteria? And also, can we know how will this change swabbing and mass testing priorities? Like, for example, the preschool teachers who have been discharged clinically well at day 21, but then they test positive, can they go back to work? Thank you.
Yes, DMS?
We haven't worked out the overall number of patients that would now immediately benefit from this particular strategy, but I would imagine that there would be a few very happy patients who would be currently staying in our community care facilities that would be looking forward to being able to go home after having spent weeks in one of our community care facilities. So there is going to be some change in our processes as we move away from routinely testing all these patients after a period of time to assess whether they are negative. The swab testing priorities we have continue at this stage. The tests that we perform are for various reasons. It's just that what we are going to do now is to reduce the number of tests we need to do for the purposes of clearing patients from our hospitals and community care facilities to return home. However, the tests continue to be done, and some of this freed up test capacity, in fact, can be then rediverted towards prioritizing testing in a variety of different contexts. One, of course, for the diagnosis of patients with COVID in our dormitories, our migrant workers who are living there. Secondly, for the purposes of trying to assess the prevalence of infection in those dormitories. And thirdly, of course, to clear them, those workers who are fully recovered, so that ultimately they may be able to return to work, supporting the economy as we progressively move away from the circuit breaker restrictions and move from phase 1 eventually into phase 2. Also, the freed up capacity can then also be used to support the various testing strategies that we have, similar to what we're doing now in vulnerable populations and in settings where staff are looking after vulnerable people. We want to make sure that these vulnerable populations are properly looked after and protected, and our testing strategies will then be prioritized towards making sure that that indeed takes place. So there will be some realignment of our strategies to accommodate the increase in capacity we now have for that particular purpose. That said, we are continuing to test at a high rate. To date, we've done more than 330,000 tests, and that would be for more than 210,000 individuals. That translates to something in the order of more than 58,000 tests per 1 million population. So we've never stopped aggressively testing. It's just that the strategy where we prioritize might change now that we have some free capacity that we can divert for other priorities. Thank you.
Thank you. I think I should also add that as we change our discharge policy, there will be a group of patients who have been with us for a long time. Some maybe 50 days, more than 50 days. So some of these patients actually ought to be at home because they are no longer infectious. So with this change in the discharge policy, we'll then be able to allow them to return home safely, and after another 7 days, they can return back to the community or go back to work. So I think this will allow some of the patients who have been with us for a long time, and it's not unnecessarily so to allow them to return. And on the testing strategy, as I mentioned, I think a few weeks ago at the press conference, that our testing strategy are quite targeted based on the objective that we want to achieve. And this testing strategy will change over time as we switch focus from one area to another. So as we begin to open up more in our economy and the community, I think testing, regular testing of workers will become increasingly important. So this will allow us to identify, to pick up cases in the community early so that we can prevent a surge of cases in the community and also prevent the emergence of clusters. So I think these are different strategies, different objectives, and testing will be allocated accordingly.
Thank you, panelists. Can we have the next question from Aradhana from Reuters?
Thank you. Sir, my question is, some migrant workers, especially those in the quarantine dormitories, have expressed concerns about their future in terms of job security and the right to stay in Singapore. Could you respond to those concerns? And some workers have also expressed hope that their living and working conditions here, as well as their position in society, might improve after the crisis is over. Is the government considering any changes on this front?
The job security for migrant workers, actually it really depends. It's not about migrant workers per se, because it really depends on the state of the economy and it depends on the employers. So we will take care of the migrant workers during this period when they are in quarantine. That's our commitment. But once the workers are recovered and are released to the workforce to work, then really whether or not they will continue to work depends on the employers. And that is true for a migrant worker, it's true for a Singaporean worker. Because if the state of the economy remains dampened, demand is weak, it may very well be possible that employers might decide to slow down, they might decide to fold, businesses may fold, and then the natural thing when that happens is they will release the workers. In the case of Singaporean workers, the government will be committed to help them be redeployed to find other jobs or training opportunities. And in this recent budget, we announced 100,000 of such jobs and training opportunities for Singaporeans. But for expatriates, for pass holders, for migrant workers who are here, if indeed this were to happen, naturally, so they can certainly try and find other opportunities if there are employers who are looking to hire. But if the state of the economy is weak, then they may well have to decide, unable to find jobs, then they may have decide to go back. So that will be what happens in a situation where there is severe economic crisis as what we are facing now, right? That's on the jobs front. In terms of their living arrangements and their conditions, I think we have already highlighted our commitment to, it's a continuous process because we have always been looking at ways to improve, but we are certainly in the process of, in fact, looking at building new dormitories for migrant workers, and these new dormitories will be built quite soon. I've highlighted this before as well. We are looking at improved standards, conditions, so that we expand the capacity of the migrant worker dormitories. We can reduce the density in these dormitories as well. And we will also look at designing the dormitories in a different way, because the present dormitories are all designed for communal living, communal facilities, shared facilities. And we now know that in this new environment, we will have to design the dormitories in a very different manner. And so that's work in progress. We are getting designers, architects, thinking about how the new dormitories can be designed for the well-being of migrant workers, but also to ensure that the infection controls are raised to a much higher level. So all of these are indeed work in progress that are being put in, that are continuing at this stage.
Thank you, Minister. Can we have the next question from Philip from Bloomberg, please?
Oh, good to see you. Just a question regarding this, perhaps pushing up the date slightly even. I wonder how this kind of came about. Have there been, was there any pressure from the private sector or from bars, restaurants, or whomever to perhaps do this? Did this factor at all into that decision?
I will put it this way. For the businesses that are unable to reopen immediately after the circuit breaker, if you look at the recent budget, we have actually provided significant support for them. The government is providing 4 months of rental relief for SME tenants in commercial settings. 4 months. The circuit breaker is 2 months, but we have provided 2 additional months. It's shared equally between government and landlords. That's something that we have highlighted. We are providing job support scheme for businesses to be able to pay their workers and hold on to their local workers. And that extends to all businesses that are unable to reopen, and we are providing up to 75% of support for salaries of their local staff. So in terms of support for the businesses, we are doing all that we can to support businesses that are unable to reopen immediately and also to support their workers. The timeline that I've described really is premised on what we think is safe to do from a public health point of view. And we have, as I've explained, provided a very broad sketch initially, but now we are getting into greater resolution for what phase 2 might entail, a little bit more resolution on the timing, so people can have some certainty of what that timing will be. But again, I keep saying, subject to change. I've just laid out a timing. Middle of June we decide, and then phase 2 can begin before the end of June. This may not come to pass. If we have a huge cluster in early June, then in the middle of June we might decide we can't proceed. And then phase 2 may very well have to happen only in July. It can happen too. But given where we are, given the situation that we have assessed in these past recent days, and our anticipation or expectations of what can happen in the next 2 weeks, we think it's very possible that we will be able to keep infection rates low and stable in the first 2 weeks of June. Then in the middle of June, we make a decision, and phase 2 can begin before the end of June. So that's a scenario that we are working on, and we thought we should share this so that people can start planning ahead for when their businesses can start to reopen. But importantly, as I said, those that are looking ahead to reopen should make use of this timing now to start preparing and putting in place all the necessary safeguards and precautions.
I think it bears reminding all of us that in order for us to get there, it is important for us to bear in mind not to have big parties and big celebrations as we open phase 1 from 2nd of June. I think if we start with a big bang party, we are going to get into trouble. So let us continue with phase 1 in a safe way. Let's achieve a safe opening. Then by middle of June, we can make a decision when we are going to start phase 2, and hopefully before end of June.
Thank you, Ministers. Can we have the next question from Pao Ling from Channel 8?
Hi, Ministers. I have a question because just now Minister Wong actually mentioned about the dining with restricted numbers of 5. Can you elaborate more? Is it applicable to hawker centres as well? How does it work?
Yes, it will be. It will apply to hawker centres and all F&B outlets. The idea is that within each of these establishments, restaurants or hawker centres, we would want tables to be separated, firstly, 1 meter apart at least, and then for every table, the number of diners would be limited to not more than 5 people. Remember, before we went into the circuit breaker, we had a similar rule. But that time, tables separated 1 meter apart, we said 10 people maximum. Right? That was pre-circuit breaker. So we are not going back to pre-circuit breaker precisely. In fact, we are going to be a little bit tighter. You can have dining in, but the number of people per table will be restricted to 5 people. So that's our thinking on what phase 2, the start of phase 2 will be. Of course, as we progress along phase 2, that number 5 can increase to a larger number as we, again, like what we have described, gain confidence that the virus is under control, infection rate remains stable, then over time, that number can increase to a larger number. But we will start with 5 as the rule.
Thank you, Minister. Can we have the next question from Jalila from CNA Digital?
Thank you. Just want to ask, what is the threshold in terms of the number of community cases above which you may have to reintroduce some circuit breaker measures for everyone?
I remember the same question asked before, and the answer is still similar. And that is, it is not just a numbers game. It is important for us to look at the entire trend to see whether the numbers are low by going up quickly, then we worry. If the numbers are stable, but although it's slightly higher, as I explained before, as we open phase 1 and as we embark on phase 2, we do expect to see numbers to go up. But if the numbers go up somewhat but remain stable, and then we are confident that the situation is still under control. And even with the numbers, beyond the numbers, we have to look at the nature of the cases, whether they are happening in areas that are likely to have big clusters, or whether they are in high-risk areas, or whether they are in areas that are confined and controlled. So these will be part of the assessment, whether or not we are able to progress into phase 2 and when to progress into phase 2. So it's a multifactorial consideration, not just based on a single number. So I would hesitate to give you a threshold, and beyond which we will not go, and below which we will definitely go ahead with phase 2. So we have to take into account actually a series of factors, including the nature of transmission. And you asked about what kind of imposition of restrictions that we may consider. Again, as I mentioned earlier, we may not go back to a circuit breaker concept, a broad-based circuit breaker concept approach, but we may adopt a more targeted approach depending on the nature of these cases, the emergence of these cases. If they are in particular setting, we may decide to have a tighter control in specific sectors or specific settings so that we do not need to have a broad-based circuit breaker approach again going forward. But we may do sectoral or more specific targeted tightening to make sure that we do not have an emergence of a big clusters or a spike of a high number of cases every day.
Thank you, Minister. Can we have the next question from Masita from Bernama, please?
Hi, Minister Lawrence. Is Singapore currently in talks with your closest neighbor, Malaysia, on Green Lane arrangement? Or when are you looking at allowing at least for essential workers to commute again from Johor Bahru?
Thank you. We are in discussions with various countries on allowing for travel between Singapore and these countries. So that includes Malaysia. And like I said, the conversations with Malaysia are ongoing. And for Malaysia, it is also more than just about business travel by air, because as you said, there is also the issue of workers moving up and down through our land crossings. So we are indeed in discussions with Malaysia on these issues. For now, Malaysia has its MCO and we have our circuit breaker, but eventually we will have to see how best to accommodate workers who want to travel between both sides in a safe manner. So that again will look at putting in place the necessary protocols, whether it's testing of workers or for that matter, having them subject to some quarantine arrangements when they come in and out. So those are issues that we will have to discuss. The bottom line is that there will need to be new safeguards and precautions. It will not go back to where it was before, where you had such large volumes of people moving up and down through our land crossings. I don't think either side would want to see that happen without any safeguards or precautions in this new COVID environment. So we will have testing, we will have quarantine arrangements, and that's something that officials on both sides are in talks about. The key is, I think if we will have all that in place, we should be prepared that there will be the volume of people sort of commuting daily will likely come down, right? So that's not, we're unlikely to see go back to the pre-COVID environment where we have such large volume of commuters traveling on a daily basis.
Thank you, Minister. Can we have the next question from Chunket from Asahi?
Hi, Minister. I wanted to ask you on the reopening of the borders. Can we know what are some of the common protocols, such as contact tracing, that both countries, Singapore and other countries, need to have before borders can be reopened? And who will qualify to pass through green lanes? Do green lane users need to do PCR tests before boarding? And will green lane users still need to be quarantined when they reach the destination? Thank you.
Thank you. So the idea of these travel bubbles or green lane arrangements that we put in place with various countries is that, first of all, we'll be talking to countries where we believe the virus situation is under control, number one. Number two, the testing protocols have to be put in place, which means that a traveler before departure will have to be tested, a PCR test, or if they have, already been infected before, then it could be a serology test, but we have to work out exactly what that testing arrangements is. The verification of the test results is also important. And then the traveler travels by air to Singapore. We may subject the person to another PCR test because, remember, as we have highlighted before and explained before, one test alone might not be able to pick up the virus, especially when it's in the incubation period. So when the person arrives after a few more days, we might require another test just to verify. And if the testing arrangements are in place, then there need not be a 14-day quarantine period, right? Because you have the test protocols to assure you that this traveler is infection-free. So this will be for those incoming to Singapore. It will also be those outgoing from Singapore to that particular country, and reciprocal arrangements will then be made. Thirdly, so that's testing on departure, arrival. Then the third point is when the traveler is in Singapore, we will want to ensure that there is some ability to know where they are. And then should something arise, we want to be able to do contact tracing very quickly and promptly, which is something you mentioned too. So we will require such a traveler to also turn on the Trace Together app that we have introduced. They have to download the app or even carry a wearable dongle, and so that if anything were to happen, we will be able to do contact tracing quite quickly. That's the Singapore requirement, and of course the other country may have their own contact tracing requirement as well. So bilateral testing and contact tracing, those are the basic prerequisites for us to put in place such a green lane arrangement.
Thank you, Minister. Can we have the next question from Navin from Today?
Hi, Minister. This is Navini from Today. I'm just wondering, assuming that things continue on the same trajectory right now, does this mean that phase 2 could in fact be shorter than what we expected?
It's hard to say. The ones that we have highlighted at the start of phase 2 are relatively, we have outlined it. And so if phase 2 begins, all those activities that we have described would begin, right? Would reopen, activities would resume. And shops, businesses will reopen. But I also highlighted that there are some higher risk activities which we will have to discuss with the different stakeholders. And these are more complex, and we have to approach these more carefully because the risks are higher, and these are known settings which are well known both locally and overseas for being settings that are conducive for the spread of the virus. So in these settings, again, depending on the organizations, the business, and our public health experts, if we are satisfied that infection controls are adequate and are tight enough, then we might be able to allow them to start perhaps at the early part of phase 2. But if it's difficult to work in these precautions and safeguards and there are still lingering concerns, then this might have to wait till the later part of phase 2. Right? So there will be some activities that may not be able to start immediately. We will have to look at the risks. We'll have to assess some of these. I've described some of the examples earlier, and then that might start later. So depending on what the outcome of our investigations, of our discussions with these stakeholders, these might stretch on for a while. I can't say exactly how long, so it may well still be in the region of months as we had described earlier. It may be shorter.
Thank you, Minister. Can we have the next question from Andrea from Power 98?
Hi, Ministers. I actually wanted to get some remarks on the zero number of Singapore and permanent resident cases today. So obviously, is this a significant milestone considering that it's been, the first time in more than 3 months, I think, that there's been 0 cases. And, scientifically, what does it mean to have 0 cases? Is this just a case of the testing speed at the labs? So that was my question. Thanks.
Just a point of clarification again, it's not the first time in 3 months that we've had 0 cases. We've had 0 cases before, not just among Singaporeans and permanent residents. I think even for the community, we've had 0 cases. So the numbers every day were, there will be a bit of bouncing up and down. So we've had 0 cases, and then after a while we've had a few cases. The recent days we've had a number of new cases emerging, but we should also understand some of the increases that we've seen in the past few days, where we have had a handful of, a few cases coming up, were because of the active screening that we did, the testing that we did for preschool teachers, as well as nursing home staff and residents. And as we have found out later, quite a number of these cases that we picked up through the active testing, they are, not all of them are new cases or new infections. In fact, after we've gone in to test them, a number of them are asymptomatic, but for some of them, we've also tested them on the serology test, and they have tested positive on the antibodies test, which suggests that the infection took place sometime earlier, not recently. Right? But because we did the PCR test, they tested positive, so we report them in the daily numbers. But the basic point is, if you look at where our new cases are, setting aside the active testing that we have done, essentially over the last few weeks through the circuit breaker period, they have been very low. Our transmission rates throughout this recent weeks in the circuit breaker have been very low. And that's exactly why we have confidence earlier to say we are exiting the circuit breaker, we are entering into phase 1. As we enter into phase 1, we have also explained with more activities, we might expect cases to rise. We have to be prepared for that. But if we are able to detect the cases quickly, ring-fence the clusters, maintain infection rate generally at a low and stable level without new large clusters forming, then we have confidence by the middle of June to decide to move to phase 2, as I have explained just now in the timeline.
I think it's important to also bear in mind that the number that we announce every day is the number of test results that we have obtained for the day or the day before, so that we report it today. But these test results could have been on patients who have been infected some time ago, and they have come to seek treatment maybe a few days after they have fallen ill, and when we test them, we have the result, then we announce it. And even before that, the patient might have gotten ill a few days ago, but he or she might have been infected again a few more days ago, because there's an incubation period, after which then he falls ill, and then he comes to see a doctor, then we pick up the sample, we test, then if it's positive, we announce the result. And therefore, the cases that you see every day, actually the infection would have happened quite a few days ago, maybe weeks ago. And for the serological test that we have announced, that we have shown, explained earlier, among the preschool teachers, although the 12 cases happened probably within the last 1 week, but actually the infection happened much longer than that. So it is not a daily, the numbers that we show is not the current infection, but it is a result of the testing. So you just have to bear that in mind, and therefore it's important to bear in mind that it's the trend that we have to pay more attention to, rather than day-to-day variation in the cases. Otherwise, when you have 0 cases, we are very happy. Tomorrow we may have a few cases, but this may be a result of infection that were a few days or even weeks before. So just bear that in mind, that's the nature of tests.
That's right. And as the Director of Medical Services, I'm always very happy to be able to be given the opportunity to announce 0 cases of an infection. But statistically, it's very difficult. The trend is correct, but it so happens that it's with announcing 0 cases of Singapore residents today. It doesn't necessarily mean that tomorrow we will not have 1 case, for example. But the overall trend is very encouraging. The overall trend is in the correct direction to suggest that, in fact, community transmission of COVID-19 currently is under control with the circuit breaker measures. It should not lead us to be complacent and think, therefore, that as we lighten up post 2nd of June, that we can do all sorts of things and disregard the need for safe distancing. It remains very crucial that we continue to practice our personal hygiene, safe distancing, the wearing a mask, especially when we move out of the house. These are the measures that will continue to keep our community case numbers down. But if we fail to maintain that vigilant discipline, then as we loosen up on circuit breaker measures, it is inevitable that we'll see a rise in community transmission and cases. So it's very important. Do not be complacent. It is good to see 0 cases today, but we must continue to be on our guard.
Thank you, panelists. We have time for the last 3 questions. Can we have the next question from Nicholas from Yahoo?
Hi, I wanted to go back to the cap on the number of people that would be allowed for social interactions and family gatherings and in F&B outlets as well in phase 2. I was just wondering, can the task force elaborate on how it arrived at the number of 5 and why it's considered safe? And what about households with more than 5 people? Will they also be required to sit separately?
There is really no magic number, right? You can set 2, you can set 5, you can set 8, 10, and you look around the world, you will find different countries setting different numbers. We think that 5 is a reasonable balance, looking at the assessment of risk and the assessment of the situation that we are in today. 5 means that if an infection were to happen, then you limit that cluster to that group of 5 people who are together with that infected person at any one time. If you obviously allow 10 people, then potentially the cluster that can form will be larger, and because there are 10 people, each person may have another 10 contacts, then all that multiplies, right? So we think if you set it, on the other hand, very tightly, 2 people, then that may be a little bit too tight at the start, and it will be very conservative, but you will have potentially a lot of families who will not be able to even gather together. So the balance we struck was about 5, and indeed, if your household is more than 5, the rule of 5 will still apply. So 5 people max, and then if you have more than 5 who want to go out for dining in, they sit in different tables.
Thank you, Minister. Can we have the next question from Mindy from BT?
Hi, evening. Are we looking at all retail and F&B followed by higher risk activity settings? So are there plans to stagger the opening for within retail and F&B as well? And where do motor showrooms and condo show flats stand? Are they considered higher risk activity settings? Thank you.
So again, it will be F&B and retail, as I said, together in the start of phase 1. And then there will be also a range of consumer services. It would include, motor showrooms, show flats, potentially within the beginning of phase 1 too. But we are getting into a level of detail that really, we are painting a very broad sketch of what phase 2 could be like, and we're talking at the start of phase 2, right? So at the stage when we are ready to announce phase 2, then we will certainly list out all of these different services. But we do expect, as I said, at the start of phase 2, if all goes well, if the conditions remain favorable, then we will allow these broader range of activities to resume, and that would essentially mean that virtually the entire economy will reopen by the start of phase 2. But there will be some activities that are of higher risk. I've explained what they are, and we think these will need extra care to work out appropriate safeguards and precautions before we can allow them to resume. And that may take some time depending on the particular organization or entity.
Thank you, Minister. Now can we have the last question from Humaira from BH?
Hi, Minister. I would like to ask, because you mentioned about allowing 5 people to dine in and all that. Does phase 2 also mean that more family members can visit their elderly at one go, and if congregational prayers can be done in places of worship? At the same time, for essential travel, that's they'll be open up for businesses and all that. Will there be exceptions for those who have family members or spouses overseas? Thank you.
Okay, sorry. Let me try to go through the question one by one. The first one was about the rule of 5 applies to, like I said, everyone, whether it's dining in or family visits, right? So family visits, subject to visiting a different household, people from different households will, in our thinking on phase 2, then it need not be limited to one household, because already in phase 2, social interactions can happen in groups of 5, right? So you can go and visit another household, but subject to the rule of 5 people maximum, right? That's on the visiting side. Whether it's social interactions in that small group of 5, dining in or family visits, that same rule of 5 people maximum would apply. On congregate prayers and congregational prayers, today we already have said that in phase 1 opening, the places of worship can reopen for private prayers, subject to 5 people at a time, and then they can go in and within the same household, and then they can go in to have their own private devotions and private prayers. That's already allowed for under phase 1. So for phase 2, we potentially can expand, but whether or not we can have congregations gathering, as I said earlier, I highlighted that religious services is indeed one of the settings where we have had transmission happening, not just in Singapore, but also overseas. So in such a setting where there is an enclosed space, large groups of people, I think there are higher risk, and we will then have to work out with the different religious organizations what are the appropriate precautions and safeguards. It may well require some additional rules about capacity, about the number of people, certainly safe distancing, and then everyone has to wear masks. We may have to look at the kinds of activities that are permitted as well, because it is quite well known that singing, for example, is an activity that brings about transmission very easily. So these are the kinds of discussions that we want to have with religious leaders, as well as other business owners in the areas where we think that they are of higher risk. And then we will work out the necessary safeguards and precautions before we can allow such activities to resume. Finally, you had a question on essential travel. What is it again? Can you remind me?
Will there be exceptions made, for example, for Singaporeans who have family members or spouses who are actually living overseas?
Okay. I think that's a different category, right? So if we're talking about essential travel for work, and we think that's important for the economy, for businesses, but importantly to protect jobs for Singaporeans. Because if the business says, look, my people cannot move around, then I might sort of relocate to another country. Then jobs will be lost. So we are focused on essential travel for work reasons, and we will limit the numbers. Even under a green lane arrangement, the numbers will be limited. Right? So there will be quotas set, and then we will have to prioritize who can travel for such reasons. But the scenario that you described, I think, falls under a different category, which relates to family members who may want to travel or who are overseas now and who may want to return. So for that group, whether you want to travel or you want to return, come back, and you are not a Singaporean, but you are maybe a dependent pass, maybe a spouse, but not a citizen, and then you are overseas and you want to come back as a returnee, we already allow some numbers to come back. We already do, but again, it's subject to a quota, because when they come back, they have to serve the stay-home notice for 14 days in a dedicated facility. And because these facilities are limited, we set a quota for the number of returnees every day. So as we look at the situation, if our facilities expand, we have more facilities, if our testing capacity expands, then potentially the daily quota for returnees coming back can increase as well over time.
Thank you, ministers and panelists, for your time today, and thank you everyone for attending today's press conference.
Just to clarify a statement I made earlier, just to make sure I had it correct. I had mentioned the WHO guidance on clinical management of COVID-19 that was issued yesterday. Just to clarify, for symptomatic patients, the WHO recommends that it's safe to de-isolate or discharge a patient 10 days after symptom onset, plus at least 3 days without symptoms. And symptoms would be either fever and or respiratory symptoms. Thank you.
Can I just, maybe one last point to end with this reminder to everyone. We've put out the roadmap, we've put out the timelines of when we can move from phase 1 to phase 2. How fast we can go about doing this, whether or not this timeline we have sketched out can materialize, depends critically on every Singaporean, on every resident. If we all do our part, if we are all vigilant and socially responsible, all the way from now till the middle of June, then we stand a good chance of being able to proceed with phase 2 before the end of June. But if people choose to disregard the rules, they choose to continue to flout, breach the rules, and take reckless actions that may cause clusters to form, then it will be very, very hard for us to proceed on these timelines. So we want to call on everyone. Let's do our part. We are all in this together. So let's be responsible. Let's all cooperate during this critical period, and then we will be able to make a decision soon on whether or not we can move to phase 2.
So let us work together so that we can progress towards phase 2 and eventually arrive in phase 3 safely. Thank you very much.